Paul Maher here, Smart Financial. Welcome back. Thanks for subscribing to our channel. Stay in touch with us for our live meetings that we're doing in New England, from Portsmouth, New Hampshire, down to Providence, Rhode Island. We're also doing some webinars. Just keep in touch with us and you can keep up with all that data. Today's topic is really important. It's called Medicare versus Medicaid, right? And frankly, it's embarrassing that we have to explain this to so many people, because even folks in government, believe it or not, don't understand the difference between Medicare and Medicaid. If you listen to any of the recent hearings, I'm talking about hearings for people that are nominated for offices and for cabinet posts and all kinds of different things starting last January. And I've been listening to some of these and just really have to say that we need some big time clarification, and you need to know how this affects you. Medicare versus Medicaid, two completely different programs. I'm going to explain them to you, and I want you to understand the difference and how it affects you in your life. Medicare is for everyone who gets to age 65 years old. Medicare is a wonderful program. It's health insurance, it's health insurance, it's health insurance. There's three parts to Medicare. Medicare Part A covers if you go to the hospital over age 65. Medicare Part B is outpatient things. It has a cost to it. Normally it comes out of your Social Security payment, or you could actually write a check for it, right? It's called Part B premiums, right? Then there's Medicare Part C, which is a combination of A and B with a private insurance company. Some call it Medicare Advantage. That's Part C. Some have premiums and some don't. And then there's Medicare Part D, as in drugs, drug coverage. And a lot of these plans are combined, but that's all Medicare. A, B, C, D. You're entitled to it if you're 65 or older. In fact, I will tell you, there's an open enrollment every year. We've been very active in the Medicare business for a number of years. It's October 15th to December 7th. Please don't wait. If you're within 3 months of age 65, you need to get into the plan now. You can enroll them. There are some penalties for delaying and missing your open enrollments. What's most important is, if you're turning 65, you have a thing called a special election period, an SEP. The special election period means no medical requirements whatsoever. You're going to get on. No financial requirements. You're going to get on. If you're within 3 months before and 3 months after your 65th birthday, you're golden. Enroll. I'm on it. I will tell you, we have been in business 50 years. I ran a financial practice for many years, which we've now turned over to our younger partners. No one ever complains about the way Medicare pays bills. Medicare is a spectacular system, and we need to protect that system long term. I'll get into that later. Next, if you're not on Medicare, you might be on Medicaid, A-I-D. Now, this is very different. Medicaid can be for anyone at any age. It's financially qualifying. And in order to be on Medicaid, by the way, this is a federal program administered by state governors, and it has a lot of different names. And some of the names are things like in Massachusetts, they call it Mass Health. But it's really a federal program for low-income people. And I have to actually look at my notes to tell you how low income you have to be. This is for people who are essentially in the poverty level income of about $21,000 of annual income. That's a low number. I'm talking about $21,000 of annual income to be on Medicaid, right? This is a program for the poor. It also, in the Medicaid system, there are three parts. There's health coverage. There's a special program which is for children's CHIPS, Children's Health Insurance Plan, for children of low-income families. And then there's a third part, which is called SNAP, S-N-A-P, Supplemental Nutrition, right? That's a supplemental nutrition assistance. We used to call it food stamps, which is $800 a month to keep your children fed. These are super important programs to, are you ready? 71 million people in America are on Medicaid. Okay, let me say that again. Out of 350 million people, there are 71 million low-income people in America that are on Medicaid. They could be 20 years old, 30 years old, 40 years old. People go on Medicaid, then they get prosperous and they get off Medicaid. They start to earn income. You can actually earn up to maybe 125% of the poverty level. But these are very low-income people that need this coverage. And states are fighting right now about Medicare and Medicaid cuts. Now, Medicare cuts affects everybody who's over 65. Medicaid cuts affect those primarily poverty level income. Now, why are we fighting about this? And excuse me if I get a little wound up, but this is what it's all about. Ray Dalio, the famous manager of a hedge fund, said, this is not a tax problem, it's a debt problem. And I agree with him. We have debts and we need to cut down our costs so we quit borrowing money to increase the national debt. Okay, I believe that 100%. However, what we're trying to do right now, what Congress is trying to do, is to renew a tax program that saves, are you ready, 3% for the highest income people. That means, let me put it into dollars for you. To extend the tax breaks that were passed previously, what they call the Trump Tax Act, right? To extend that would save 3% income tax on a person who's earning $1 million a year, okay? Now, what does that mean to a person who earns $1 million a year? It means $30,000. In order to extend that $30,000 savings, they want to cut from Medicaid. That means cut benefits for people that don't even earn $30,000 a year. This is a very imbalanced system. To pay for the tax cuts for the millionaires, they want to cut benefits for the poverty level. So this is like what we call reverse Robin Hood. Instead of stealing from the rich to give to the poor, it's stealing from the poor to give to the rich. Okay, that's what's proposed. I don't want to talk about the politics of it, but I want to talk about how it affects you. Medicaid currently pays for, I have to look at my notes, 63% of all the people in nursing homes. Now, if you've ever had a loved one go to a nursing home, I've had personal experience with this. Nursing homes are not pleasant. A lot of them are like human dog kennels, right? People get in there, they're expensive. And what happens is if you run out of money in a nursing home and you're elderly, Medicaid can pay for your nursing home care. So right now, 63% of all the people out there in nursing homes are being paid for by Medicaid. That means that 30-something% of the people are paying. But here's what the problem is. If Medicaid cuts off those people, where are they going to go? You have around 7 million senior citizens lying in beds on Alzheimer's. Well, what are you going to do with these people? In this proposition to extend the Tax Act, they want to add a thing called a work requirement. Now, I don't know how many of these people that are on Alzheimer's in beds are going to go to work and get jobs. Or how many of these young children that are under age 13 on food assistance are going to go get jobs. They say it will save $100 billion out of the $800 billion they want to cut. They still will have to cut $700 billion from the Medicare Medicaid system. This is a very extreme cut. Now, I don't know if it's going to happen, but I'll tell you what. Most important, if you're a senior citizen and you're on Medicare, I would say you need to pay close attention to your Medicare supplement plan and your Medicare Advantage plan, because those two plans are what's going to soak up the slack. What does that mean? If they cut down, let's say you have a $10,000 claim and Medicare now pays 80%. So you have a $2,000 piece you have to pay. I think in the future you might have a $4,000 piece. So if they cut down Medicare benefits, you as a senior have to pay more. You need to pay a lot of attention this year, 2025. If you're a senior citizen, what coverage you have in the event that Medicare benefits are cut. And by the way, they're cut all the time. Talk to your local physician about Medicare payments. They're continually being cut. They want to cut them some more. Now, if you live in a state with a lot of Medicaid people, by the way, New Mexico is the largest number of Medicaid covered people in the country next to Louisiana. These are both like huge numbers. 33% of the people in New Mexico are on Medicaid and 32% of people in Louisiana. That's a third of their population is on these low-income subsidy programs. I don't know what to do to help them, frankly. I think that if you are on Medicaid, you're on thin ice already. And if your Medicaid benefits are cut, it's going to have a serious impact on your health, your children's health, your children's nutrition. But here's the really big problem. If you have family members in a nursing home, and this is very important, if you are thinking that your family member in a nursing home is safe because you're paying in cash, let me tell you, they're not safe, because 29% of the nursing homes in America will go out of business because over half their budget comes in from Medicaid. So what does that mean? Your grandma's in there, she's paying in full, there's 100 beds, 30 people are paying in full, the other 70 people are paid for by Medicaid. If Medicaid stops paying, the nursing home goes out of business. What are we going to do with grandma? Where is she going to go? You need to be prepared, even if you are affluent and you have a loved one in a nursing home, you need to talk to them, see if they are a Medicaid qualified nursing home. I don't think they'll give you the number, but if they're Medicaid qualified, then you should assume half the people are on Medicaid. Ask them how long they would stay in business without Medicaid payments. We were told recently by one of our clients who went in to visit her husband, who's in a nursing home in Massachusetts that I won't mention. They were told that if Medicaid cuts, they would be out of business in 2 weeks. 2 weeks. She's, of course, really upset. You would be really upset. So even if the budget is cut by $100 billion because of the work requirement, they take $700 billion out of the Medicare Medicaid system, there's going to be a ton of stress. So what do you need to do? Even if you're affluent, you need to talk to the nursing home where your parents are living to see if, in fact, Medicaid cuts will affect them negatively. Now, the other part of this, I have to say, is that there are waste, fraud, and abuse in the Medicaid system. There are a lot of people who are very affluent who fake like they're broke to get on Medicaid and make all the rest of us pay their bills. Like I happen to think that is blatant Medicaid fraud, and I hope that the people that are looking for fraud, I can't say it fast, fraud, waste, and abuse, catch those people, because it's just not fair. Medicaid was designed to take care of the poorest people in America. It's a wonderful system, right? It's a social network system. But the abuse of having people who hide their money so that they can basically give all their money to their family and their kids and then make the rest of us pay their bill, that is the kind of work I hope they do at Dodge or whatever it is. I hope they root out the fraud, waste, and abuse by people abusing the Medicare system. So that's just my little political comment on this. But being aware of how Medicaid and Medicare is going to affect you is part of the art of being smart. And I'm Paul Marwood. I'll see you again next time on Smart Financial Lifestyles.